The Western Cape's immunity level can be assumed to be at nearly 60%. Analysis of the data available indicates that South Africa's particular circumstances and patterns of immunity provide some clues to what may lie ahead. At least that's the view of the University of Cape Town's Public Health and Family Medicine Department Emeritus Professor Jonny Myers. Professor, good evening and thank you so much for your time tonight. Firstly, let's talk about this idea of herd immunity. There's been huge debate about whether or not it actually exists. What is your own view?
Well, I would rather like to say we could talk about population immunity. There must be population immunity, otherwise the epidemic would not wane after it increases to a peak. So herd immunity is the idea, the concept where sufficient people in any group of people are immune to a particular infectious agent, usually like a virus, and that there aren't enough people who are susceptible to infection for the virus to propagate any further within that community. So the community could be at the level of it's heterogeneous. It's not the same everywhere. It could be a small family, it could be a grouping, it could be a town, it could be a suburb, etc. But usually when it's used in a broad way to indicate that level of immunity in the population that is built up sufficiently to stop the virus from propagating.
So then what would be the difference between herd immunity and population immunity?
Well, herd immunity is an epidemiological concept, and it's been used for many years, and it simply describes that level of immunity at which an infectious epidemic declines and hopefully disappears or goes to a level where it grumbles on and doesn't cause too much trouble. So that is the concept. It's not really a policy or anything like that. It's a concept of it explains why an epidemic first increases and then decreases.
And if I'm hearing you correctly, are you saying that herd immunity applies in the situation of South Africa or not really?
No, I think at the moment we've built up quite a substantial population immunity. And I'm basing this on some studies that have been done. And on the fact that the epidemic has waned. I mean, if you take the Western Cape, for example, if you look at the curve of deaths, it's come almost back to zero, the baseline, before the epidemic. So that can only be because there is a very substantial amount of population immunity.
And where does this leave South Africa? Because you've also compared South Africa to other European countries who've had a significant battle with COVID-19, and you've reflected on how you think the country has fared.
Yes, well, I think that here in South Africa, in a way, we've been quite lucky. All the provinces have followed the Western Cape, which was the earliest one to be infected, quite quickly, within a month or two, and the epidemic's gone up and then it's come down. So for the country as a whole, we are like way past the peak, and we're going to go all the way down to that baseline or near that at some point. So I think that from the point of view, and we've had quite a severe epidemic. I mean, it hasn't been a mild epidemic, as some people have said. There's been this notion that Africa or African countries are having a mild epidemic. It's just not true. We've had quite a severe one, probably as severe as in some parts of our country as New York City or London or whatever. So they now, of course, are ahead of us, and they are now very worried about what they call a second wave. And they are experiencing an increase in viral activity. And that second wave is really, at the moment, mainly a second wave of cases. But, cases are like unreliable. They don't tell you what's really going on. You really need to look at deaths. And in these countries, despite a substantial recent increase at the end of summer now in the Northern Hemisphere in cases, the number of deaths remains very low. So I think that's what I've looked at that, and I've said, well, what's going to happen for South Africa? It's not as if we've had a mild epidemic. We should have built up a lot of population immunity. And if we look ahead for us, we're also going very favorably into summer, not winter. So my sense of it is that if our cases start to tick up again, we aren't going to experience another serious high surge of deaths like we've just come out of. So that was the point of the article that I wrote. That's what I think one can learn from what's going on in the countries that are ahead of us time-wise.
Sure. And how closely can we make the comparisons between South Africa's data and what we're seeing from the rest of the world, when we know that there have been lots of questions around the kind of data that we've received from certain provinces who there wasn't really consistency in the capturing of numbers?
Yes, we can't trust any data outside of the Western Cape, I'm afraid. It's just really, as I said, cases are not important, you can't use them, and deaths are severely underreported. But what we can do is we can compare excess deaths. So the excess deaths for the country as a whole are known, and for each of the provinces is known. And if we look at the Western Cape, which has been quite good with data, it's about 70% of the deaths that have been reported, or 70% of the excess deaths that have turned out to be COVID deaths. So we can use that as some sort of lower bound estimate. And we can say on that basis that South Africa as a whole and most of the provinces have had quite a severe epidemic. Certainly, sorry.
I just wanted to ask, why do you believe that the Western Cape's numbers or data collection was better than everywhere else in the country?
Because I think that we have a very good provincial health department, which is very well organized, offers very good clinical services. It has a public health division and capacity which is really quite exceptional. And they have, from the very first day, the Premier sent out a newsletter on the internet counting all the cases in all the health districts, and every day both cases and deaths have been reported, and pretty reliably. And as I say, the fact that the Western Cape is able to record 70% of the excess deaths as reported COVID deaths is to me a great sign of reliability.
And what about the fact that the Western Cape was also the first province to limit its rate of testing when it came to COVID-19 tests to just those patients who either desperately needed the test or showed signs of comorbidities, and of course for healthcare workers?
Look, I think that has, from the beginning, we've been sort of hindered by a lack of sufficient capacity, and that was just a practical decision that had to be made. One had to try and test the people who were most most at risk. So I think that isn't really a factor. I think if we had had the sort of superabundant test capacity that we now have in some countries, not many, even overseas, we might find more cases amongst younger people, asymptomatic people, or people with mild infections. But I don't think it's got much to do with the testing, actually.
All right. Professor Jonny Myers, thank you so much for your time. And he is with the University of Cape Town.